السلام عليكم. وياكم الدكتورة فاطمة حمدي محمود، واليوم إن شاء الله راح نشرح لكم infectious disease in pediatric age group. We will discuss in this lecture Roseola infantum, measles, and rubella. This three disease has a shared presentation اللي هو fever and rash. We know the fever is elevated body temperature, but we need to know the type of rash to know the disease that we are dealing with. First type of rash is maculopapular rash. Macular means discoloration, skin discoloration. Papular means elevated skin lesion. We see this type of rash in the measles, roseola, rubella, Epstein-Barr virus infection, and scarlet fever. Second type of rash is diffuse erythema. Diffuse means widespread, and erythema means red discoloration. We see this type of lesion in the scarlet fever, toxic shock syndrome, which is Staphylococcus aureus infection. Third type of rash is urticaria rash, which appear as elevated lesion, which seems to be edematous. We see this type of rash in the mycoplasma infection and Epstein-Barr virus infection. Third type of rash is vesiculobullous rash, which is cystic skin lesion filled with fluid. This appears in case of herpes simplex virus infection, varicella infection, which is chickenpox, and staphylococcal infection, bullous impetigo. Fifth type of rash is petechial rash, pinpoint small red discolorated rash, skin rash. We see this type of rash in meningococemia. First topic in this lecture is Roseola infantum. Exanthem sabitum. What we mean by exanthem? We have two terms in infectious disease, exanthem and enanthem. Exanthem means widespread rash on the skin. Enanthem, same rash but affects mucous membrane. المرض السابع هو قديما كان هذا هو سادس مرض يسبب يعني منتشر بالأطفال. هسه ماكو هذا الترتيب لأنه أكو other disease more common than roseola. This roseola infantum caused by two viral type, which is human herpes viruses type 6, which is more common in children less than 2 years old, تقريبا 80% of cases. أما التايب 7 هذا تكون more common in older children older than 2 years and 10 to 30% of cases. This both are DNA viruses, which is of herpes virus family. ال6 هو عادة التايب 6 هو major cause of acute febrile illness بالinfant. Clinical manifestation: roseola characterized by high fever, often more than 40 CDZ. High fever, lasting 3 to 4 days, followed by maculopapular rose-colored pruritic rash, appears with remission of fever. يعني أول شي راح يظهر الفيفر تكون هاي، يستمر 3 إلى 4 أيام، بعدين راح يظهر الرش. The rash usually lasts 1 to 2 days but may fade rapidly، يعني في نفس اليوم يظهر ونهاية اليوم يختفي. Roseola is associated with approximately 1/3 of febrile seizure. الهاي فيفر مالته وعادة الأطفال راح يجون كفبرايل seizure. Treatment. There is no specific treatment for roseola. Routine supportive care include the following: maintaining adequate hydration and antipyretics. Second topic is measles واللي هو نسميه الحصبة. measles is highly contagious disease. هو مرض يعني عنده قابلية عالية للترانسميشن، لكن بسبب الوايد سبريد فاكسينيشن الترانسميشن قل بهاي الفترة. RNA viruses in the family of Paramyxoviridae and the genus Morbillivirus. Transmission of measles. The portal of entry of measles virus through the respiratory tract or conjunctiva, following contact with aerosol droplet in which the virus is suspended. يعني شلون يكتسب الشخص الانفكشن عن طريق respiratory tract or conjunctiva. Patient are infectious from 3 days before. كلش مهم نعرف شو وقت patient is infectious. From 3 days before and 4 to 6 days after onset of rash. يعني قبل الرش ب3 أيام وبعد الرش ب6 أيام تقريبا. هذه هو يعني البيشنت هنا كلش infectious لازم يعني ينأزل. Measles are serious infection characterized by high fever and maculopapular rash. To understand the clinical manifestation, we need to know about pathology. The main pathology in measles infection is that measles virus cause necrosis of the respiratory tract epithelium and accompanying lymphocytic infiltrate. Second, produce small vessel vasculitis on the skin and oral mucous membrane. These two pathogenesis are responsible for the clinical manifestation. The measles virus has 4 phases, which is incubation period, prodromal phase illness, exanthematous phase and recovery phase. First, incubation period. هو incubation period هو 8 إلى 12 days. إيش راح يصير بهاي الفترة؟ The virus migrate to regional lymph node and there will be primary viremia, viral spread to reticuloendothelial system, and secondary viremia occur. بعدين ينتشر virus spread to body surface. Last 8 to 12 days. Second is prodromal phase, which is 2 to 4 days. Begin as conjunctivitis with photophobia, coryza, cough, and increasing fever. هنا راح يبدي الفيفر. بالبرودروم إيش راح يصير؟ After secondary viremia, there will be epithelial necrosis in body tissues and viral shedding will begin in this phase. فشي أكون مميز بالميزل اللي هو الكوبليك spot represent the enanthem and are the pathognomonic sign of measles. But we should know that Koplik صح إنه هو pathognomonic لكن not all cases of measles has Koplik spot and not all Koplik spot are measles. لكن إحنا بسبب إنه الميزل تكون highly contagious راح يجي كإبيديميكس فإحنا نعتمد عليه. همينا لأنه يظهر في نسبة كبيرة من الميزل عندهم Koplik spot هو 50 to 70%. This Koplik spot appearing 12 to 24 hours before onset of rush. It lasts for 1 to 2 days after rush appearance. قبل بيوم من الرش بعدها يومين من الرش ويختفي. They first appear as sandy white patch spots on the minute red lesion. الموقع مالته كلش مميز an inner aspect of the cheeks at the level of lower premolar. راح نشوف on examination راح نشوف فد white sandy patch يعني spots على الريد بيس. البيس مالته تكون أحمر وموجود بمكان مميز اللي هو level of the lower premolar. هذا هو الكوبليك spot. Then rush appears. هسه نحكي عن الرش. It begins on the forehead. الترتيب مالته فد شي typical. Begins at the forehead along the hairline and behind the ears as red maculopapular eruption. It then spread to the face بعدين للوجه بعدين neck and downward to the trunk and limbs and reaching the palms and sole. palms and sole يعني مرات نشوف البيشنت يعني نشوف البالم and soles موجود بيها همينة رش. Last for 5 to 6 days تقريبا 6 أيام إلى 5 أيام الرش موجود. Then fades over about 7 days يعني باليوم السابع راح يبدي يختفي in the same manner as it evolved. Then leaving the fine desquamation of the skin. هذا شيء يعني ورا ما يروح الرش راح يترك فد desquamation fine desquamation فد قشرة تكون ناعمة. هذا هو الرش بالميزل. The major symptom of measles cough. هنا الكف last longest تقريبا up to 10 days. Generalized lymphadenopathy may present with cervical and occipital lymph node enlargement. Cervical and occipital lymph node enlargement. In this picture, this rash, the rash of the measles appear as it's combines, sometimes raised and joined together to form patches. تكون هيك تقريبا on white skin يعني راح نشوف على شكل brown or red colored lesion, but in darker skin it's sometimes difficult to see the rash discoloration مالته. Diagnosis is mainly clinical يعني بالفحص والهيستوري راح ينعرف إنه هذا measles, but confirming serological test can be done. high antibody IgM level, immunoglobulin M level, blood and urine sample. مرات الكلتشر يعني يسوون culture. Blood and urine are base sample as WHO protocol for detection of the virus of the illness. Differential diagnosis. Other diseases that present as fever and rash اللي هو rubella, roseola and scarlet fever. Very important complication مالته. Pneumonia is the most common cause of death in measles. It may be manifest as giant cell pneumonia caused directly by the viral infection or superimposed by bacterial infection. Vomiting and diarrhea, even bloody, group bronchiolitis, acute otitis media, sinusitis, mastocytitis, febrile convulsion occur less than 3%. Myocarditis is rare complication. All this occur because of the viral caused necrosis on respiratory epithelium. encephalitis 1 case من كل 3000 case. Infection may be fatal. Rarely fatal hemorrhagic measles, black measles, leading to hemorrhagic skin lesion. هذا النوع من الميزل تكون يعني نفس الرش لكن تكون bleeding. الرش يعني راح يطلع منها تكون مثل الدم فد شيء أسود. همينا راح نشوف النوز bleeding الماوث bleeding يصير بها. Subacute sclerosing panencephalitis, one of the chronic complication of the measles. This is slow viral infection, takes about 7 to 10 years after measles and it's fatal. ليش يصير هاي الحالة؟ لأنه مرات الميزل يعني تبقى dormant بالCNS ومن ينخفض المناعة راح يهاجم ويسوي panencephalitis. Treatment of the measles mainly supportive antipyretics and rehydration with respiratory support. مرات البيشنت يحتاج respiratory support. Treatment of the vitamin A deficiency. Why vitamin A deficiency? Because they found that vitamin A deficiency may be a risk factor for measles. يعني مو يسوي يعني deficiency يسوي measles وإنما measles if the patient has vitamin A deficiency and get measles, this is he will have very serious symptoms and very serious complication. Common in developing countries, associated with high mortality and morbidity in measles. So it's recommended to the patient with measles. يعني أي patient يصير عنده measles لازم ياخذ فيتامين A supplement. الدوزنج مالته تكون كالآتي. For children who is more than older than 1 year, $200,000 international unit once daily for 2 days. And if the child is younger than 6 months, 50,000 international unit once daily for 2 days. In case of patient have vitamin A deficiency symptoms, after second dose, we may give him age-appropriate dosing of vitamin A for 2 to 4 weeks after second dose. This will contribute to decreasing severity of the disease and also complication. Prevention of the measles. First, we should minimize exposure to the susceptible individual during period of infectivity, which is 3 days before and 4 to 6 days after appearance of the rash. Measles vaccine in 9 months. And we have 2 types of measles vaccine. حصبة منفردة حصبة مختلطة. حصبة منفردة بال 9 month ياخذونه with vitamin A supplement and 2 doses schedule with measles, mumps, rubella vaccine recommended for full immunity. The first dose is recommended at 12 to 15 months of age, and second dose in preschool age. For immune deficient خاصة اللي عمرهم يعني عمر أقل من العمر الفاكسين يعني مو أقل من 9 months أو أكثر old age or patient has some disease that decrease immunity. مرات يعني من يصير عندهم measles نعطيهم immune globulin intramuscular should be given. Third topic in this lecture is rubella. Rubella, German measles, or third-day measles, is a milder form of measles. Adults also can get the infection, but what makes it important is its transplacental transmission, and he causes what we causing fetal damage as part of congenital rubella syndrome. Rubella postnatal infection of rubella is mild disease following an incubation period of 14 to 21 days. A prodrome consists of low-grade fever, sore throat, and red eyes. Lymphadenopathy, suboccipital, postauricular, and lymph nodes are more prominent. On examination, this will aid in diagnosis. Same as measles, but have suboccipital and postauricular lymph node enlargement. This is rubella. In children, the first manifestation of rubella is usually the rash. أول شيء يظهر كراش, which is variable and not distinctive. It begins on the face and neck. أول شيء على الفيس والneck as maculopapular and then spread to the trunk and extremities. The duration of the rash is generally 3 days. يعني فقط 3 أيام موجود الرش. And usually resolve without desquamation. Complication of rubella is encephalitis is more in children, thrombocytopenia, arthritis or arthralgia. This arthralgia is more serious in older age, but it's milder in children. In children, it's benign and transient. A more serious complication in non-pregnant women. One of the complications of transplacental transmission of rubella is congenital rubella syndrome. The baby will born with deafness, cataract, patent ductus arteriosus, pulmonary artery stenosis, mental retardation, neonatal purpura, and sometimes death. Intrauterine death of in 35%. There is no specific treatment, but available for either acquired or congenital rubella syndrome. And thank you.